Hello and welcome to another update from the Radiation Oncology Department at BP Poddar Cancer Hospital. I am Dr. Jyotirudh Goswami and I'm very excited to tell you about two new treatments that we have recently delivered in a setting which a lot of you may not be familiar with. This is with a technique called stereotactic radiotherapy. So we've just delivered treatment for two cases of arteriovenous malformation. Now these are not cancers, they're not even tumors, these are developmental abnormalities which remain undetected in many young adults or children and often manifest with catastrophic consequences like strokes or loss of consciousness or seizures. If left untreated, they can be really dangerous. However, because neurosurgery can be quite hazardous given the location of these structures, it is felt that a non-invasive technique like stereotactic radiotherapy can be really effective in dealing with it. So we've just been treating two patients with arteriovenous malformations. One of them is a young man of 40 years of age who presented with headache. He went to a neurologist, and on examination they found this abnormal bunch of blood vessels clustered together in his brain. The second patient is even more interesting. It's an 11-year-old boy who presented with seizures back in October last year. He again attended the neurology OPD, underwent a scan, and again they found this cluster of abnormal blood vessels called an AVM. Now in both cases there were mainly three options. One was neurosurgery. The problem with that was that the location of these AVMs was in eloquent areas, so areas which control our speech and movement. The second option is something called embolization, where neuroradiologists will inject certain devices into the blood vessels to block off the blood supply in those AVMs. And the third option, which we are turning to increasingly nowadays, is stereotactic radiotherapy. Now the beauty of this is that this is non-invasive and it also acts gradually. So we believe that we pose less of a risk in terms of delivering the treatment.
Hi, I'm Dr. Subhash, Chief Medical Physician RSO, BP Poddar Hospital. Last week we treated the two stereotactic radiosurgery in our radiotherapy department, one adult patient and one child patient. This is the treatment of adult patient. We are delivering 28 gray in 4 fractions. This is another case of stereotactic radiosurgery, যেটা লাস্ট উইক আমরা একটা 11 বছর বাচ্চার উপর অ্যাপ্লাই করেছি। হাইলি কনফার্মাল, হাইলি প্রিসাইজলি আমরা ট্রিটমেন্টটা এক্সিকিউট করেছি। এটা হচ্ছে তার পিকটোরিয়াল ফর্ম।